Let's talk about the tip. Apex distance, or TAD. TAD is mainly about depth. It is a radiographic measurement used to estimate the risk of cutout. In simple words, TAD estimates how close the tip of your screw or blade is to the apex of the femoral head. But careful, the apex does not mean just any far point on the femoral head. The apex is the point where the central axis of the femoral neck and head reaches the subchondral bone. The goal is to place the screw deep enough to get strong purchase, but not so deep that it penetrates the joint. Classically, the safe cutoff for TAD is below 25 millimeters. The original method uses two X-ray views, an AP view and a lateral view. On the AP view, you measure the distance from the tip of the screw or blade to the apex of the femoral head. Then you do the same measurement on the lateral view. TAD is calculated by adding the AP tip apex distance plus the lateral tip apex distance. However, we have to be careful because X-rays can be magnified. To fix for this, we can use the known real screw diameter from the manufacturer and use it as a correction factor to estimate the real value. Now, why is a smaller TAD generally better than a larger TAD? A high TAD usually means the screw or blade is too shallow. If the tip stops too early, it behaves like a short anchor inside weak cancellous bone. Under body weight, the head-neck fragment can rotate more easily, collapse into varus, and overload the screw or blade. On the other hand, when the screw or blade tip is placed closer to the subchondral bone, it gets better purchase. Subchondral bone is denser than central cancellous bone, so the implant is supported by stronger bone. Next, there is another important measurement called calcar-referenced tip apex distance, or CalTAD. CalTAD is similar to TAD, but it modifies the AP measurement by referencing the calcar and inferior femoral head instead of the head center. This highlights the inferomedial compressive side of the proximal femur, where a slightly inferior central screw may better align with stronger bone and the main compressive trabecular pathway. To calculate CalTAD, you measure the lateral view the same way as regular TAD, but on the AP view, you have to move the femoral neck axis line parallel and adjacent to the medial cortex of the femoral neck, near the calcar. Then you measure from the screw tip to that calcar-referenced line, and so you add what you measured here with the lateral view value. A commonly used cutoff for CalTAD is also below 25 millimeters. In real surgery, surgeons are not doing all of these calculations in their head. A practical way to estimate depth is to use the known screw diameter as a visual ruler. The goal is to place the cephalic element deep, roughly 5 to 7 millimeters from the joint, centered on the lateral view, and center or slightly inferior on the AP view.